required to remove abnormal tissues and improve fertility outcomes. However, doctors warn that this treatment remains expensive for many Ugandan women, with some laparoscopic procedures reportedly costing between 7 million and 30 million Ugandan shillings. Health advocates are now calling for increased awareness, improved training for health workers, and stronger government support for diagnosis and treatment services. They say cultural beliefs and the silence surrounding menstruation continues to discourage many girls and women from seeking medical help early enough. Medical experts also emphasize that the severe menstrual pain could never simply be ignored as normal, urging women to seek professional medical attention whenever the symptoms become persistent or disabling. And health experts also say that the increasing awareness about endometriosis and encouraging early diagnosis could help thousands of women who receive timely treatment and reduce suffering, and also improve the reproductive health outcomes across the whole country. Now, moving on to our next story. When we are discussing about malaria, pneumonia, and diarrhea, attention also most of the time focuses on medicines, vaccines, and treatments, but scientists are now showing that the design of a home itself could play a role in protecting children at large, and especially from the deadly disease. A new housing project, which was tested in Tanzania, is attracting global attention after significantly reducing childhood illnesses. And here is the story. An international team of scientists and health researchers have revealed that a newly designed home known as a star home reduced cases of malaria, diarrhea, and pneumonia among children during a 3-year trial that was conducted in Tanzania. The researchers said that the innovative house design reduced clinical malaria cases by 44%, diarrhea by 30%, and pneumonia by 18% among children living in the houses compared to those living in traditional homes. The study involved specialists in architecture, public health, engineering, medical anthropology, entomology, and statistics, who work together to design a healthier and more environmentally friendly homes. According to the researchers, the star home was specifically designed to reduce disease transmission inside and around the households where children spend most of their time. The design includes raised double-story sleeping areas positioned away from the ground level mosquitoes, and improved cross ventilation systems, mosquito-proof screens and doors and windows, also self-closing doors, cleaning cooking stoves, improved pit latrines, and systems for harvesting the clean water. Scientists explain that malaria transmission in Africa mainly occurs indoors at night through mosquito bites, while diarrhea is often linked to the contaminated food, poor sanitation, and unsafe water. Pneumonia, on the other hand, is worsened by the overcrowded housing, poor ventilation, and indoor air population from cooking and smoke. Researchers say that improving housing conditions can therefore directly reduce the exposure of these major childhood illnesses. The trial followed children under the age of 13 living in more than 100 star homes and over 500 traditional mud and thatched roof houses in southern Tanzania, an area with high malaria prevalence. After 3 years, scientists found that children living in the new homes not only suffered fewer illnesses, but also showed improved overall health and growth. The researchers also highlighted environmental benefits of the star home design, saying that the houses use less concrete, generate lower carbon emissions, and cost less to construct than many modern cement block houses. They added that the homes remained cooler naturally without air conditions due to the improved airflow and the passive cooling system. Experts also said that the findings come at an important time as Africa's population continues to grow rapidly, increasing the demand for millions of homes across the continent. And researchers said that with better planning and simple housing improvements, homes themselves could become one of the most powerful tools in protecting children from the preventable diseases across the country. Now, moving on to our next story. WHO Director General praises terrain over hantavirus response. The World Health Organization Director General Tedros, he has praised the people and authorities of the Tenerife for what he described as a compassionate and well-coordinated response during a recent hantavirus public health operation involving passengers on board the MV Handias cruise ship. In the follow-up message issued from Geneva, Tedros said that more than 120 passengers from 23 countries safely disembarked from the ship and now under monitoring and care by the health authorities in their respective countries. And he commented that the Spanish government, health workers, port authorities, and the people of Tenerife for showing what he called the moral courage by welcoming and supporting the affected passengers during a period of uncertainty and fear. Tedros said that this operation proved that science, preparedness, and international solidarity can work effectively together during global health emergencies. He also paid tribute to the 3 people who died on board the MV Handia, saying that their families continue to carry deep grief despite the successful completion of the operation. The WHO Director General further extended condolences to the family of the Tenerife civil officer who reportedly died of the heart attack while serving during the emergency response. Tedros described the Tenerife as an example of humanity and solidarity at a time when many societies are choosing fear and isolation during the crisis. He added that he hopes to return to the Tenerife in future under peaceful circumstances, and this time as a visitor with his family rather than part of health emergency response. The WHO says monitoring efforts for the passengers and the crew members will continue until everyone safely completes the quarantine and reunites with their families. Now, moving on to our next story. Africa pushes to integrate traditional medicine into the mainstream health systems. Leaders from the government, academia, regulatory bodies, youth networks, and also community health innovators have renewed calls for stronger integration of traditional medicine into Africa's formal healthcare system, saying it could help expand access to the care and reduce treatment costs across the continent. This discussion took place during the World Health Summit regional meeting held in Nairobi, Kenya on 29th April 2026 under the session theme Traditional Medicine as part of the solution, reimagining primary health care and universal health coverage in Africa. The meeting was supported by the World Health Organization Global Traditional Medicine Center as its partner, the Charity Competence Center for the Traditional and Integrative Medicine at Charity University in Berlin. Panelists emphasized that the need to move beyond policy decisions into full implementation for the global traditional medicine strategy for the year 2025 to 2034, calling for national governments to fund institutionalized traditional medicine programs. Experts noted that traditional medicine remains widely used across Africa, especially in rural communities where access to modern health care is highly limited or expensive, making it integration into the primary healthcare system increasingly important. They stressed that for integration to succeed, countries must strengthen regulation, improve scientific research, and ensure that the traditional practices are self-evidence informed and properly monitored with national health systems. Professor Martins Imeje, the Director General for Nigeria's Natural Medicine Development Agency, urged African governments to prioritize funding and implementation rather than symbolic support, saying that the progress depends on real investment and accountability at large. He also highlighted the importance of involving indigenous communities in shaping traditional medicine policies to ensure cultural relevancy and protect local knowledge. drainage systems. Participants further called for stronger collaboration with bodies such as African Medicines Agency to improve the regulation, research, and intellectual property protection in the sector. The meeting concluded with a shared commitment to strengthen community-led, culturally grounded healthcare approaches as part of the improved universal health coverage and health system resilience across Africa. Now, moving on to our final story today, Tunisia is declared free of trachoma disease as the public health problem, and this was by the WHO. The World Health Organization has officially validated Tunisia as having eliminated trachoma as a public health problem, marking a major milestone in the country's decades-long fight against the preventable blindness. WHO Director General Tedros congratulated Tunisia, saying that the achievement demonstrates what sustained political commitment, strong primary healthcare systems, and community teamwork can accomplish in the public health sector. Trachoma, a bacterial eye infection that can cause irreversible blindness if untreated, was once widespread in Tunisia, particularly in the southern regions, where limited access to water, sanitation, and hygiene fueled the transmission. Health officials said that the country achieved elimination through the WHO-recommended SAFE strategy, which combines surgery, antibiotics, facial cleanliness, and environmental improvements such as better water and sanitation systems. Tunisia strengthened its response through nationwide strengthening campaigns, integration of eye care into the primary health care and school health programs, and continuous community awareness efforts on the hygiene practices. The Ministry of Health in Tunisia described the validation as the historic achievement, accrediting decades of coordinated national efforts involving health workers, communities, and international partners. WHO said Tunisia now joins a growing list of countries that have eliminated trachoma as a public health program, and it will maintain surveillance systems to ensure early detection of any possible re-emergency of the disease. Health experts say that the milestone reinforces global efforts under the Sustainable Development Goals to eliminate neglected tropical diseases and also improve the eye health worldwide. Now, congratulations to Tunisia for embarking on such a milestone in health. Now, to our dear viewers, those are our stories for today. We are going to take a look at a video to find out what exactly happens inside our eyes, because today we are going to be focusing on a critical condition that normally affects our eyes. But before we head there, let's take a look at that video.
Okay. Open your eyes and let the world in. Follow me on a journey into your body's second most complex organ after the brain. But pay attention now, all of this will happen in the blink of an eye. First job at hand, get inside. Let's follow this dust particle. It floats up and lands on the cornea. That's the outer dome covering your eye. You can feel its shape right now. Close your lids, put your index finger over them, wash your hands first, and move your eyes side to side. Feel that bump? That's it. No blood vessels here. Your corneas get oxygen directly from the air, so your eyes breathe. But it's full of super sensitive nerves. They sense something foreign, and the fastest muscles in your body get to work. Your eye blinks. That dust particle gets washed away. Let's try this again. The only way to get into the eye is with light. That's how your vision works. And it's why you can't see in the dark. Duh. But how do we see objects that don't emit light themselves? The light coming from the source, be it a light bulb or the sun, hits the object. Some of it gets absorbed, and some of it bounces off and enters our eye. It's a nice reflection on you. More on that a bit later. For now, it's way too dark in this room. Somebody flip a switch. Ah, that's better. We zoom along, going the speed of light, and pass through the cornea. It's dome-shaped to help focus light where it goes next, the lens. But before we get there, we pass through the pupil. It's not a black circle in your eyeball, It's a hole. Black because there's no light inside your eye. Red eye in flash photos is because the light from the camera is passing through and bouncing off the back of your eye. It's full of blood vessels in there, so your pupils glow red. But this pupil's too small. I can barely squeeze through. Oh, the light's too bright. The tiny muscles in your irises, that's the colored part of your eye we know and admire, have relaxed to make the pupil smaller. This doesn't let too much light in and protects your eyes from excessive brightness. Turn the lights down a little and the iris muscles contract. The pupil gets bigger as the eye demands more light to be let through. There we go. We pass through and come upon the aspirin-sized lens. Like your ears and nose, your lens continues to grow throughout your whole life. And just like in a camera, it focuses the light even more. That way, it hits exactly where it needs to be on the retina. That's the back of the eye. I can see our human here is nearsighted. Things far away are blurry. Look at where the lens is focusing the light into a single point. It's not on the retina, but a little before it. This happens when
Thank you for watching. Hope you've learned something. And today in our expert discussion, we are going to be discussing an important eye health topic that affects many people and of all ages. These are the refractive errors of an eye. Many of the people struggle with blurry vision, headaches, eye strain, or difficulty seeing objects clearly, and may not realize that these are some of the signs of the underlying eye condition that they may be facing. So what exactly are the refractive eye errors? What causes them, and how can they be corrected or managed before they affect our learning, work, and our daily life? To guide us through this discussion, we have been joined by a very important guest. And this is not just a doctor. He's a very trained professional, and is going to help us guide us and understand the different types of the refractive errors of an eye, their symptoms, causes, diagnosis, and also the available treatment options. And this is none other than Dr. Umoja. You're most welcome, sir.
Thank you, madam.
Thank you for coming.
Thank you.
How was your journey coming here?
Journey is okay. Not traffic here.
Traffic?
No.
Okay. Okay, thank you very much. So, doctor, to begin with, let's start exactly with what exactly is the reflective error of an eye. Like, in simple terms, what does that mean?
So, refractive error, in simple terms, it means the eye's inability to focus light direct to the retina.
Okay.
Because when light is not refracted to the retina, that means you will not be able to see well.
Okay.
That's where we get conditions like myopia, what we can call short-sightedness. Okay. Hyperopia, the one commonly known as long-sightedness.
Okay.
There is what we call astigmatism. So that one combines the two. Okay. Then and last one is the presbyopia.
Okay.
Yeah.
So these are the conditions.
Those are the 4 types of refractive errors we have.
Okay, so doctor, also how does the normal vision differ from someone having a reflective error?
So the normal vision, usually you can identify it by doing the visual acuity test. So when you are taking a visual acuity, it helps us to know the eye's ability to see. Okay. There are normal distances where you can say that if someone can see, like now we can use vision 20/20, that means the person has a normal vision. Yes. But there are those who can and the vision is deteriorated to like 20/40, or we can use 6/6 or 60/60. That
Okay.
means a normal person, if you are seeing that TV in 60 meters,
Okay.
then you find someone who doesn't see it, you have to pull
Put
it
it a bit
a
closer.
bit closer
Yes.
for him or her to see it clearly, maybe in 6 meters,
Okay.
of which a normal person sees in 60 meters.
Okay.
That means that person has
Issue.
a
Yes, I-
vision problem.
Okay.
Yeah, and vision problem sometimes it consists of many
Many things.
things,
Okay.
not only the refractive errors, but all in whole you have to do the thorough checkup of the eye. Yeah.
Okay, doctor, why do you think these conditions affect many people today? Because you find people putting on spectacles, for example, me, of course. But why do you think they affect many people today?
Today, I think even before it was there,
Okay.
but because of the what can I say? We had no people. They were not awareness. The awareness
Yeah.
of today
Yes.
is not like the past.
Okay,
So today there are very many facilities for eye
for eyes.
eye services.
Okay.
Someone can get services anywhere.
Okay,
But before, people used to stay with their
issues.
not
even noticing.
not knowing that it is a general problem or it's a problem.
Okay,
Because I always receive patients or clients who came while know for them they know they are seeing,
okay.
but after taking
Them through,
yes,
and they find themselves.
that's when they realize that hey, kumbe this
I
my
have an
eye is not
issue.
I have an
Okay.
eye issue.
Okay.
Yeah.
I understand. So what you're trying to say that what is making this condition a bit more nowadays, it's because of the awareness.
Yeah.
The time people didn't know more about the eyes and
Yes.
its issues. Okay, if we are to look at the epidemiology of the refractive errors in eyes, do you think as a country, Uganda, is it increasing or decreasing? How are the cases, the cases that are out there? The incident
So
rates?
it is increasing. I don't know. I think even the lifestyle, because this when we talk about some of the causes, some are genetical,
Okay,
and some people they are born with
with the issues.
with the issues. It's in family. It's just
Okay.
moving generation to generation. So and some it is just lifestyle.
Okay,
Lifestyle like these days you find many children they are always indoor
indoors inside the house.
inside the house. So when someone keeps himself inside the house, he doesn't
Go
outside
get
and look
sunlight from outside.
Yeah, at times it can also cause someone to get dirty refractive errors.
Okay.
Mostly even those people who I always hear someone who was put in basements, I don't expect that person to stay there for some long time and come back when he's
Okay.
the vision is still okay or clear in the way as it was before.
Okay, so we've seen that the cases are increasing nowadays, and you also talked about that one of these days nowadays what is making these cases become like a lot is because of the awareness. So can you please explain to us how are these refractive errors diagnosed professionally?
So these refractive errors can be diagnosed by doing thorough checkups. But when I say thorough checkups, we start with the vision.
Okay.
Because when you come to my clinic, the first thing to do is the vision.
Okay.
To take the visual acuity. How far is your eyes able to see?
Okay.
Get. So from there, I just know this person can see well or not.
Okay.
If you are not seeing well, then I go to next step, what we call the refraction.
Okay.
We do refraction. It can be a subjective refraction or auto refraction.
Okay. What
Yeah.
is exactly subjective or refraction?
Subjective refraction, I can do it manually.
Okay.
Yeah, changing lenses by lenses.
Okay, so
Yeah.
that's changing lenses.
Yeah.
Yes.
I can try this and try this and try this, and not until I get where you
Something
can-
that fits your eye
Yes.
properly.
So auto refraction, I just use machine. You just put your head here and your
And then
eyes.
you change.
Yeah.
Okay.
Then I check. Then I get the measurements of your eyes.
Okay.
Yes.
Okay, thank you very much, doctor. So at what point should someone go for an eye checkup?
I think it is needed regularly,
Regularly.
at least 2 times in a year.
Okay.
And know how you, because it's not only the refractive errors. There are many issues.
There are many
of the
issues
eyes.
that occur.
Only that today we picked this
reflective
topic,
errors,
yeah.
yes, as a topic.
But there are many issues which affects the eyes. There are many diseases, because for us we receive different types of people
Okay.
and with different complaints.
Okay, so doctor, also can children have the reflective errors without even realizing them?
Of course, because as I told you that some refractive errors are genetic.
Okay.
So you can be born with. Yeah, it can be born with that refractive error. There are those people who are born like because refractive error, like sometimes like astigmatism.
Okay.
Astigmatism, that sometimes you find the cornea, it's irregular,
Okay.
or it's not, it has not grown in its normal shape. Some, instead of growing in the curved shape, it can grow in the coned shape, protruding outside. So that one can affect the light to hit the retina directly. So that condition, or we call it keratoconus.
Okay.
Keratoconus, it can, at times it is genetic. It is born with. So if you are born when you have that condition, keratoconus, automatically you can have the refractive error.
Okay, thank you very much, doctor. And now I think we are heading straight into the types of the reflective errors. You talked about myopia. Let's start with myopia. What happens in an eye when someone has this condition for myopia?
Myopia. Myopia, in simple terms, it's short-sightedness.
Okay.
Those are people who cannot see far. They can only see near objects.
Yes.
You get? So those people, that means when they are focusing, because when you are focusing, there is what we call the light rays.
Okay.
The light rays comes and hit the cornea. When it hits the cornea is transparent in nature,
Okay.
and it allows that light to pass through. When it passes through, it goes to the lens.
Okay.
We have the lens inside the eye.
Yes.
So that lens is also transparent in nature. It also allows that light to pass through. By passing through, it is also its work as the lens to bend that light rays, because it comes when it is scattered from different directions. When you are looking, it comes this. So when it reaches the lens bend it straight to the retina.
Okay.
So people with the myopia, that means some of them, their lenses are too strong.
Okay.
It bends light before reaching the retina.
Okay.
So it bends light before the retina and make its focusing point before the retina.
Yes.
That means that person will not be able to see very far things. Yeah.
Okay. Okay, why are distant objects blurry while others are close, in this case for myopia?
For myopia.
Yes.
Myopia, as I told you, that it's short-sightedness.
Yes.
So those people with short-sightedness, their vision is more clearer when the object is close, and becomes blurry when it is far. Yeah.
Okay, so you say that the light, before reaching before reaching the retina, the rays stop on the way.
Yeah.
Okay.
It stops on the way, but because the the work of the eye is to see.
Yes.
So the eye strains a lot
Okay.
to bring that light to see that at least you see that small one
thing.
you are seeing.
Okay, now
You get.
I understand, yes.
So the eye strains a lot to push that light rays to reach there, because when the light rays doesn't hit the retina, because the retina, let me talk about the retina. The retina works as like a film in a camera.
Okay.
You get. When these images comes, it reaches the retina. When it reaches the retina, it's the work of the retina to send that images or that message via optic nerve to the brain.
Okay.
Then the brain interprets and bring message back, and you see what you are supposed to see.
Okay.
So if that connection is not there, that's why you are struggling to see.
Okay.
Yes.
Okay, doctors, also can screen time worsen myopia? Can screen time like maybe watching, viewing from a laptop, a phone, can it also is it some of the something that triggers myopia as a reflective error?
Not so much, because those people with myopia, they prefer seeing near.
Yes.
And sometimes these phones or computers, at times they are near you.
Okay.
You get.
So the eye won't strain.
You can only strain when you are looking in a far
Very far,
distance.
yes.
Yeah. And you find some people when they are focusing in a far distance, they get tired easily.
Okay.
You see someone is getting tired, you see some tearing comes, and at the end of the day you start complaining headache, because the eye strains a lot for you to see, because you are forcing it to see where it cannot reach.
Okay.
You get. So you get at the end you find you get headache. Maybe some children's, when they are studying, you see they are performing badly.
You don't know it's
and that is very common, mostly in children. For them, they don't know. They think the way they are seeing it the same as others seeing.
Yes.
Not until you come for the checkups and they tell you that your child cannot see well.
Okay.
And the challenges we get, you find is some parents, they cannot believe that their children are sick
yes.
and supposed to put on either glasses to correct that refractive error. They say, doctor, I think these glasses can worsen the situation.
Yeah.
It's not. I think this boy not yet. Let us wait. Kumbe the condition is worsening.
Okay.
Yeah.
So, doctor, I think let's just go straight to hyperopia. What, in brief, what happens in this condition?
Hyperopia. So hyperopia, that one, I think is the opposite of myopia.
Okay.
That those people are long-sightedness.
Okay.
So by long-sightedness, that means the light rays passes it meets behind the retina.
Okay.
You get. This one is meeting before reaching the retina. The other it meets behind the retina.
Okay.
Yeah.
Okay, why do you think people with hyperopia struggle more with reading and work, specifically general work?
Yeah, of course, people with the hyperopia also, as I told you, because you have to focus direct to the retina.
Yes.
But because you don't focus direct the retina, that means when you are seeing far than near.
Yeah, yes.
You get. So that means those one with near vision, when they put here, they okay.
They can see.
They can see.
Yes.
So the other one with the long-sightedness, when you put near things, it's not okay for them. You get?
Yes.
Because the light rays which passes the retina, you have to bring it back closer such that you see them.
Okay.
Yeah, and you find with with the far distance, at least a little bit they can try.
Okay.
But here,
It's hard.
then it becomes a problem.
Okay, so doctor, there is also something that sometimes people misunderstood the hyperopia with normal stress and fatigue. When they can't see things that are so close, most especially in the old people, that old age group, they sometimes mistake it with fatigue and stress. What's your take on that?
Hyperopia also causes fatigue,
Okay.
or what we call strain, because at the end of the day, the eye strain is a lot
Okay.
for you to see, and that hyperopia, it causes headache.
Okay.
Its main symptom is headache. So people with hyperopia, at times they complain too much headache.
Okay.
Every day, and you find someone is always moving, clinic to clinic, checkings, your typhoid, malaria, what.
Yet it's hyper.
Yet the problem is the eyes, and at times the headache is either frontal headache or temporal headache.
Okay.
You get. So when those people, when you correct that hyperopia, the
Then
person
they get
will
some relief.
Yes, the person will get relieved.
Okay, thank you, doctor, for that explanation of that. And let's move on to the other one, which is astigmatism. How does it work?
So astigmatism, so that one, that is a condition whereby we get double focusing point.
Okay.
So the focusing point does not direct to the retina. So
Okay.
this myopia, it comes and focus before the retina.
Okay.
The other one comes and focus behind the retina. But this one, it comes and be parallel like
Okay,
this.
like
Doesn't
this.
meet anywhere.
Okay, it goes
You
in
get.
different directions.
Yes. So that one, sometimes it is the problem might be on the lens, or it might be on the cornea.
Okay.
The curvature of the cornea, as I told you, when the cornea has not grown in its normal shape, it can cause that. You find it's like this here, there is its point, and here there is its point. So
Okay.
it does like this.
Okay.
Yeah.
So, astigmatism sounds a bit technical. And what exactly causes this distorted vision sometimes? What leads to that most of the time?
To astigmatism. So that one, as I told you, the nature of the cornea.
Cornea. Oh, okay.
Because I told you the cornea is supposed to be in the curved shape. You get? So for some people, it is in a coned shape.
Okay.
Coned shape. When it's coned shape, that means light rays, when it comes, each one is focusing on its own. You get?
Yes.
And make a parallel focusing point.
Okay.
So where you find there is a refractive error and there is a problem with the cornea.
Okay.
So you have to correct the error and correct the nature of the cornea.
Okay, so also let's talk about presbyopia. So what happens during
So
that?
presbyopia commonly is age-related condition.
Okay.
So that one mostly
It's among the old people.
Yeah, let me say 70% of the people, they can get that problem.
Is it even unavoidable after 40 to most of the people? Is it a must that someone will get presbyopia?
Yeah,
It's unavoidable. It has to be there.
It has to be there.
Okay.
Because when the lens is growing, when you are focusing on near things, it enlarges.
Okay.
When you are focusing far, it becomes small. So doing this and this, that means there is that muscle. So when you are growing, we get that rigidity. Rigidity of the lens becomes hardened. That doesn't do the work. It doesn't accommodate. We call it accommodation. So when you are growing older, so the lens becomes rigid.
Okay.
And it doesn't do the accommodation. So it remains by focusing. That's why you see those people with the presbyopia, when they say when they are looking at this, they cannot see the letters clearly. You get?
Yes.
There's that inability of reading small letters. But when they, at times, you see some of them, they struggling to do like this.
To see.
You get?
Yes,
because
I understand.
because the lens is, it remained there in seeing far.
Not
so
close.
Seeing far, they okay, they are seeing well.
But close.
But when they put it like here, all the things are not clear.
Okay.
You get?
Yes.
So when they do like this, it becomes clear.
Okay.
So what we do also the refraction and give glasses. So we correct that problem by glasses. And the different thing with the presbyopia, even glasses, it goes in years. What you have used at 40, you cannot use it at 45.
Okay.
You cannot use it at 50. You cannot use it at 55. So you keep on changing the lens
every time.
because it is age-related condition.
Okay.
The more you grow, the more you add on the power of what you are using.
Okay.
Yeah.
So, Doctor, let's go straight to the prevention part of it. We've seen that there are many types of refractive error issues. How do you think people can prevent themselves from getting these errors?
So, prevention, I think depending on the cause.
Okay.
So, and some causes, at times there are no way you can prevent them.
Okay.
Because some it is genetical. Maybe this lifestyle, lifestyle allowing children to move, not anyhow, they get to move, staying outside and see the environment, not indoors every time. So that one can help. Those people who always stay in darkness for a long time, they can also eliminate it. I think that is it, but things concerning about the nature, you cannot, I don't know how you can prevent them.
Okay.
Yeah, I don't know how you can prevent them.
So it cannot be caused by these other problems. It is something that comes naturally.
No, maybe let's say, retinopathy of prematurity. Retinopathy of prematurity, those children who are born premature.
Okay.
So those, because they when they are in their mother's stomach, they get nutrients and oxygen from the mother. But when they are produced, most of them when they are produced before 32 weeks, you have to put them in incubators.
Yes.
So incubators, that means you have to apply oxygen. And at times, that oxygen, when it's too much, it affects the retina.
Okay.
You get? It affects the retina. And when it affects the retina, so at times, we can get even people who born when is blind and never even see the world.
Yeah.
Others, when God helps, it develop those refractive errors like myopia. But at times it is because of the too much concentration of oxygen applied
in the incubator.
Yes. So that one can be worked on. I think, but that is on the side of the medical workers.
Okay, so Doctor, we've seen all that, but we find sometimes what doctors do when people have these refractive errors, they give them glasses.
Yes.
And after some time, when the person goes back for a recheck, they add them more glasses with more lens for these other ones before leaving this one for old people. But for myopia and all that, they add more lens. Why do you think it's like that? Thought they're supposed to treat them and they go away. Is it something that cannot be treated? And
so like myopia, it can only be corrected by glasses.
Okay.
So glasses, you cannot remove them. Glasses doesn't cure
Okay.
Doesn't cure
The areas of the eye.
the myopia or refractive error, but it helps to correct
Correct.
that
not
problem.
curing. Okay.
So the moment you remove it,
You won't
you will
see.
not see.
Okay.
The moment you put on, the vision is corrected.
But is
and
there
see.
any cure for?
So the cure is the refractive surgery. You can do refractive surgery because if the problem is cornea, and as I told you, there are those with the keratoconus, and it is the one causing that refractive error, like astigmatism.
Okay.
So they can do a corneal transplant, and that person is
Okay.
get better.
Okay.
So if the problem is the lens, they can do what you call LASIK what? Surgery, or using laser something. That's how we do it. Then they flatten the cornea and other things. Then somebody starts seeing without even glasses.
Okay.
Or they can implant the new lens. They move the other one which has a refractive error, and
They put another one.
they put another one after doing the proper biometry and do the measurements of your eye,
eyes.
what you are supposed to, which lens are you supposed to use clearly.
Okay.
Then they can remove the natural lens and put the artificial one, what
Okay.
we call the intraocular lens.
Okay.
Yes, they put the artificial one, and then it get cleared.
Okay.
Though it is very expensive to some people.
Yeah.
Yeah, and another one, you can use a contact lens instead of using this one.
That's
You
it,
just
like-
insert it
I got it.
inside and you move.
Oh, okay.
Yeah.
Thank you very much, Doctor, for that wonderful insight on the reflective areas of eyes. Now, as we are winding up, what's your last take on these areas?
So in these areas, I advise our people mostly to do eye checkups,
Okay.
because it is the only way where you can know that you have a certain problem of
Okay.
your eyes. At times people are there, but they don't know. In fact, they don't know. People they don't know.
People are not
I
aware.
always go there in the outreaches in the village, but you find people there, they are really suffering. Yeah, they are really suffering. They don't know. So when you get any chance, most people who are near the services, you use that chance and do
check.
it.
Okay.
Yeah.
Okay, thank you very much, Doctor. Now, as we are winding up still, please send greetings to 2 or 3 people who are watching you, and then we can call it a day.
Yeah. First of all, I send my greetings to all my customers of Umoja Eye Clinic, because they are on TV watching.
They are watching.
Yeah.
Okay.
So I greet them. Thank you for your support. So Umoja Eye Clinic is located in Kasangati.
Yes.
It's at Sendege Plaza, opposite the Kasangati Health Center,
Okay.
or near Comfort Cottage Hotel. So I'm located there.
Okay.
So we
Maybe
do,
there you leave your number for the people who have questions and who would like to come and do checkups on eyes.
yeah, my number is 0759 18 44 72 or 0784 18 16 75.
Okay.
Yeah.
Thank you very much, Doctor.
Thank
To
you.
our dear viewers, that has been Dr. Umoja from Umoja Eye Clinic, and he has obviously directed you to his location. For if at all you have any question you would like to ask, please contact that number, you will be answered. And today we have seen that our eyes connect us to the world, yet many of us only pay attention when problems become severe. So early checkups, proper care, and timely treatment can prevent the vision and also improve the quality of life. So thank you for tuning in for today, and this is an urgent call for you, our dear viewers, to take care of your eyes as we have learned today. So this has been your health show. Let's meet again next week on Monday to Friday from 4 to 5 p.m. So TV1, as we say, it's see the difference. You have more programs lined up for you, so don't change to any other station. Stay on this one, and may God keep yourself. Let's see you next Monday.